Well, hello and welcome to Ask the Doctor. My name's Jerry McGee and I'll be the host for today's show. We're down here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thanks for your time today. On today's show, we want to cover a problem of lower rib cage, abdominal pain. We had one of our viewers write in where they were having some kind of pain in this lower area of their abdomen, and they've been to some doctors. They weren't really, nobody really truly understands what, or is giving them any type of diagnosis to it. They can't seem to really kind of relate it to anything, and they wanted to know what your opinion would be and the benefits of coming down here to meet you.
My experience has been like something like that. It could be coming from the rib cage. There's a thing called rib torque. It's coming from the back. Like a lot of people wear seat belts, okay? So you got the seat belt on, and then what you do is you torque your spine like this and you rotate, and what that does is that affects the rib cage. There's like a bone out of position, the ribs, the vertebrae, and that presses on the nerve. And what happens is, Jerry, you get a flank pain. So what it does is that's a fancy way of saying it refers. So yeah, your organs are normal, your appendix is normal, your gallbladder, but it's coming, you're having a pain, it's not coming from the organ, it's not coming from where the pain is or the site, it's being referred from the rib cage, the spine, the back. So we call that a rib torque, we call it flank pain. We get to the underlying root cause of why they have the pain. 9 times out of 10, it's coming from their spine.
And I would think that a lot of times when you're having pain down here in the abdomen area, I would think people would want to relate that to organ problems or like something very, very serious where, you know, as we've seen many times, you have to look at the basic, you know, structure and function of your body. That's where a lot of the times where the problem is coming from. It's not necessarily some rare problem. Could be something as simple as you said of getting an adjustment for a rib cage.
My advice is to go to the medical doctor, get it rolled out, make sure it's not your appendix, okay, make sure it's not your gallbladder, your liver, or a vital organ, or your intestines. And once you get that all null and void, then it's the time to do the conservative approach, because 9 times out of 10, it's not coming from the organ, it's coming from the structure, the spine, the rib cage. We can adjust the rib torque, we can adjust the rib cage, we can basically adjust any joint in the body. Okay, and as you adjust the joint, that frees up that nerve, and that nerve is going to that cell, that organ, that muscle, and 9 times out of 10, the person's functioning better, they're performing better, and they're out of pain.
So really, if somebody watching this video has any type of problem where they're at a point where they're almost kind of throwing darts at the problem, you know, it's they're not sure if it's this, well, let's try this. What they really ought to do is pick up the phone, give you a call, come on down, and just get that evaluation. And see firsthand what can happen, because it could be something as simple as you know, as what you're saying right here.
A lot of times it is something simple.
Yeah, and can have a lot of great relief right away. So instead of taking that kind of throwing darts at it approach, you know, pick up the phone, give chiropractic care a chance. I mean, if you haven't been to a chiropractor ever in your life, you owe it to yourself to one, become educated on what chiropractic care can do. Look at the different approach that chiropractors take to this whole practice of medicine. I think you're going to be amazed at how, one, the results you're going to have and the difference in really the treatment protocol that you're going to have. They truly look for that root cause of your problem. They're going to look at your entire, life, how everything kind of fits in. You know, our life's a jigsaw puzzle. You got to put it all together. You got to look at all the pieces. And that's what chiropractic care does for you. So, you know, what we really want to stress is that, you know, education is the key. Don't be afraid to ask, or get a second opinion on a problem. Pick up the phone, give Dr. Goldberg a call here at Wellness Associates. They offer a great new patient free evaluation where you can come down, see the facility, meet the staff, meet Dr. Goldberg, go over your problem, and he's going to, kind of share the treatment protocol with you. I think you'll be amazed at the results and the knowledge that he has and can relate to you. And really, I think you'll find that giving chiropractic care that shot is going to make all the difference in the world as you move forward and really try to achieve this thing of optimal health, which is what we're all after. We don't need to keep going from one sickness or illness to the next. We can live a long and healthy life, and that's what the goal here at Wellness Associates is. So pick up the phone, give Dr. Goldberg a call, come on down, set up an evaluation, meet him, see firsthand what he can do, and really start to understand the power of chiropractic care. So we appreciate you watching this video. Be sure to check out his website at AskDrGoldberg.com. Some great information there, great blog posts, videos. He'll answer some questions on there as well. It's just a great way to kind of get connected into this world of chiropractic care. So we really appreciate you spending some time with us today. Hope you found this information to be informative, and we look forward to seeing you on future videos. Have an awesome day.